You know, Russ, one of the most interesting things about attending an international dental conference is seeing the different approaches clinicians from around the world take to solve the very same clinical problems we face here every day. The fundamental science is the same, but the philosophies and applications can be quite different.
That's a great observation, Brandon. It's a powerful reminder that while human biology is universal, a molar is a molar, a jawbone is a jawbone, the context of healthcare is not. How a patient perceives their oral health, their aesthetic goals, their dietary habits, and their expectations for treatment are all profoundly shaped by their cultural background.
And understanding those differences is a key part of providing truly patient-centered care in a diverse society. It's not just about being aware. It's about adapting our approach to meet the patient where they are.
That's the perfect entry point for our discussion today. Welcome everyone to Oral Surgery Insights. I'm Dr. Russ Lieblick and I'm here with Dr. Brandon Rehrer. Today we want to take a broader look and explore some of the fascinating cultural differences in oral health beliefs and surgical practices around the world.
Our goal isn't to create a definitive encyclopedia, but to foster a greater appreciation for the diverse perspectives on oral health. It's a discussion that enriches our understanding as clinicians and, we hope, will be interesting and enlightening for our listeners as well.
A great place to start is with aesthetics, because the concept of a perfect smile is far from a universal standard. In many Western cultures, particularly here in the United States, the ideal is often heavily influenced by media: perfectly aligned, straight, and exceptionally white teeth.
This aesthetic ideal drives a huge demand for cosmetic dentistry, whitening procedures, and orthodontics. But this is a relatively recent and culturally specific preference. If we look historically and globally, we see vastly different ideas of what constitutes a beautiful or desirable smile.
A classic historical example is the practice of ohaguro in Japan, where blackening the teeth was considered a mark of beauty, maturity, and status for centuries. It's a striking contrast to the modern Western focus on whiteness.
Even today, in some cultures, a gold tooth is a visible symbol of wealth and prestige. In other parts of the world, a diastema, a gap between the front teeth, is considered a sign of beauty and good fortune. Here, that same gap is often one of the first things parents want to correct for their children with orthodontics.
It's so important from a clinical perspective. A patient's cultural background directly influences what they perceive as a problem worth fixing. What one person sees as a unique and attractive characteristic of their smile, another might see as an imperfection that makes them self-conscious. Our job as clinicians is to listen to the patient's goals, not to impose a single, uniform aesthetic ideal onto them.
And this even extends to perceptions of tooth color. The ultra-white, opaque look is a very specific modern ideal. In many parts of the world, a more natural, slightly off-white or translucent shade is considered perfectly healthy and normal. Understanding these different aesthetic values is key to a successful and satisfying outcome for the patient.
Beyond aesthetics, traditional dietary habits around the world have a direct and powerful impact on oral health, creating very different patterns of dental disease.
This is a huge factor. If you look at populations that have historically consumed traditional, low-sugar, high-fiber diets, you often see much lower rates of dental decay. The mechanical act of chewing tougher foods can have a natural cleansing effect on the teeth, and the low-sugar content doesn't provide the fuel for the acid-producing bacteria that cause cavities.
In contrast, the widespread adoption of a Western-style diet, which is often high in processed foods, refined carbohydrates, and sugars, has unfortunately led to a global increase in dental issues. The issue isn't just the sugar, but the texture. These foods are often soft and sticky, so they adhere to teeth longer.
This creates a perfect storm for cavity-causing bacteria. That dietary shift is one of the most significant public health challenges in modern dentistry. We also see specific cultural habits with direct oral health consequences. The practice of chewing betel nut or pan, which is common in parts of Southeast Asia and the South Pacific, is a major example.
While it's a significant cultural practice, it has well-documented and severe effects on oral health. It causes significant staining and wear of the teeth, and most critically, it is a major risk factor for developing oral submucous fibrosis, a precancerous condition that causes stiffening of the mouth tissues, and oral squamous cell carcinoma, a type of oral cancer.
This is where cultural sensitivity and public health education becomes so important. As clinicians, we must be aware of these practices to properly screen for and manage their health consequences in patients from these backgrounds, while still being respectful of the cultural context. It's about providing health information, not passing judgment.
There are also significant differences in dental and surgical practices themselves across the globe. The training, regulation, and standards of care can vary considerably from one country to another.
This is something we touched on when we discussed dental tourism. The United States has a very rigorous and highly specialized training pathway for oral and maxillofacial surgery, with years of hospital-based residency after dental school. That model is not universal. In some countries, the scope of what a general dentist can do might be broader, and the pathway to becoming a specialist might be different.
We also see different treatment philosophies, particularly regarding tooth preservation. This often stems from different historical dental traditions. For example, some European models have a deep-rooted history in complex prosthodontics and endodontics, aimed at saving a natural tooth at all costs, sometimes with very intricate and heroic restorative efforts.
Whereas the American model, while also valuing tooth preservation, has sometimes been quicker to embrace extraction and dental implant replacement as a more predictable and durable long-term solution for a severely compromised tooth. This we can sometimes find in the US as well, due to outdated thinking and training in our dental schools.
The adoption of technologies like dental implants also varies widely. In countries like the US, South Korea, or Germany, implantology is a very mainstream and common part of dental care.
In other parts of the world, due to economic factors, lack of specialist training infrastructure, or different prevailing treatment philosophies, implants may be a relative rarity. In those regions, traditional fixed bridges and removable dentures remain the primary methods for tooth replacement. The materials we use, from the titanium in an implant to the bone grafting materials, are all rigorously tested and cleared by the FDA here. That level of regulatory oversight is not a given everywhere, which can introduce unknowns regarding quality and long-term biocompatibility.
It's also vital to acknowledge how cultural beliefs and traditional home remedies can influence a patient's approach to their oral health and when they decide to seek professional care.
This is a very important area for clinicians to understand. A patient's cultural background can influence everything, from their explanation for why they have a dental problem to their willingness to accept a proposed treatment.
For instance, a patient might come from a culture where it's common to use a specific herbal poultice or remedy for a toothache. The important thing for us is to acknowledge their effort to care for themselves, and then gently explain. That can be very soothing for the symptoms, but our X-ray shows the source of the problem is an infection deep inside the tooth, which needs a different kind of treatment to be fully resolved. It's about adding our knowledge, not dismissing theirs.
Yes, we want to be building a bridge of trust. Trust is also built by understanding different communication styles. In some cultures, a very direct, one-on-one discussion between the doctor and patient is the norm. In others, a more family-oriented, consensus-building conversation is expected, and it would be inappropriate not to include family members in the consultation.
Adapting our communication style to be respectful of these norms is a key part of cultural competency. When a patient feels that their beliefs and their family structure are respected, they are much more likely to be open and trusting, which leads to better collaboration and ultimately, better health outcomes. It's about treating the whole person, not just their mouth.
As we look to the future, it's interesting to see how globalization is influencing some of these cultural differences. The internet and social media are certainly spreading certain aesthetic ideals, like the Hollywood smile, across the globe, which is increasing the demand for cosmetic and orthodontic treatments in many countries.
At the same time, there's a growing appreciation in Western medicine for some of the holistic approaches to health that have long been a part of other cultures, emphasizing the powerful connections between diet, stress, and overall well-being, the very mouth-body connection we've talked about before.
Information about modern treatments and evidence-based techniques is also being shared globally among clinicians like never before. So, while cultural philosophies might differ, the underlying scientific principles for procedures like implant placement or bone grafting are becoming more and more standardized, which is a very positive trend for patient care everywhere.
But even with these global trends, understanding and respecting cultural diversity in healthcare is more important than ever. The best care is always that which is tailored to the individual, and a person's cultural background, their beliefs, and their values are a fundamental part of who they are.
So Russ, it's clear that oral health is not just a matter of universal biology. It is deeply intertwined with culture in so many ways.
It is. From what we eat, to what we consider a beautiful smile, to our beliefs about healing and our expectations for treatment, culture shapes it all.
As clinicians, having an awareness of and respect for these differences is essential for connecting with our patients and providing the most effective and compassionate care. And for patients, it's helpful to understand that different valid approaches and philosophies exist.
It's a fascinating and humbling aspect of our work that reminds us to always keep listening and learning from our patients. We hope this discussion has provided an interesting and respectful look at the diverse world of oral health. Thank you for joining us on Oral Surgery Insights.
We appreciate you spending your time with us today, and we trust this conversation has broadened the perspective on this very human aspect of healthcare.
We wish you all the very best.